I'm just going to wait to make sure everyone's in. Sure they can join us. Okay. Good afternoon, everyone, and welcome to this afternoon's press conference. As always, you're very welcome here. It's a rather miserable Friday in terms of the weather. Today we are joined on the panel by Rosin Harris, who's a consultant in public health. And we're also joined by Joe Watt, who's the GP chair for the Northamptonshire CCG. We were due to be joined by Simon Weldon from the Northampton General, but as we all know, they are very, very busy at the moment, and unfortunately he's not able to make it today. So any questions for him, we may have a very general answer on some of them, but most of them will probably have to refer back to them. As I'm sure you'll understand, they are extremely busy at the moment, and therefore they can't always make these appointments because they're working so hard. We also have, we were due to have Becky Bradshaw from the university. Again, they are working furiously away in the background to get our students home, so they're not able to make it. She's not able to make it today either. So we're actually recording today as well. We're not going out live, so there will be a bit of a delay once this is downloaded, but I'm sure that it will be available for everyone to have a look at within a couple of hours of the meeting ending, or at least or quicker, depending on the download times. So what we're going to do today, thank you for your questions as well from our friends in the press. We'll do what we normally do. So we'll go to Rosin Harris for a quick update on the surveillance report, and then we're going to go to give us some perspective from the point of view of the CCGs, and then we'll come to the questions that you've submitted. Although, as I've already said at the start, some of those questions for Simon Weldon will probably we probably won't be able to answer in full, though we will try our best with the panel members that are here. We are joined by a number of other people as well. Superintendent Elliot Foskett is here, Jonathan Nunn is here, Tom Beattie is here, and a couple of other people as well. So there is an opportunity for, when I open it up to questions, that you may have some questions for them as well. But I'm going to pass now to Rosin to give her update on the latest surveillance report. Good afternoon, Rosin.
Many thanks, Councillor Morris. Thank you. And as we wait for the slides to be presented, and I'm sure these slides will be shared with you shortly, the first slide just reminds us that as of Wednesday, England has now entered a 3-tier alert system, and Northamptonshire has been placed into tier 2 of that alert system. So if we move straight to slide 3, which just outlines some of the tier 2 restrictions, just to remind everyone of some of the restrictions in tier 2. So firstly, around exercise. So classes and organised sport can take place outdoors, but indoors there should be no household mixing. So indoor sports for elite athletes and under 18s for educational purposes and disabled people only. Around socialising, again, there's a requirement not to mix with other households indoors. Around travel, there's advice or guidance to only make essential journeys and walk or cycle if possible. And then similarly with work, if you can work from home, then please do. There are much more details about the various restrictions on the website, so we've put a link there should you want to, and I'm sure you all have access to .gov website to see those already. If we move to the next slide, just to give some key messages that we want to remind everyone in Northamptonshire of. First of all, just to really please strictly adhere to those tier 2 regulations. We've now began to see some of the positive impacts of lockdown in terms of reducing case numbers in the community. However, we don't want to undo all of that hard work. Throughout the year, all of us have made significant changes to our lives and had to sacrifice quite a lot. So I think it's just really important that we don't give up now. The second point, just to remind everyone that we do need to protect our older, more vulnerable population. Cases in the over 60s are on the increase. That is a real concern for us, particularly as those are the people who are at greatest risk of adverse effects of COVID and more likely to die from this virus. And then finally, as of the 1st of December, flu jabs now available for those between the age of 50 and 64. This is not a group that usually is offered the flu vaccine unless they have underlying conditions. So if you are in this age group, then please do get your flu jab. If we move on to the next slide, looking at weekly case rates. So as I said, in this last week or last 2 weeks, we have begun to see a reduction in cases. And I just want to add a note of real caution against this data. First of all, that we're looking at data that is up to the 29th of November, so about 5 days old. And those are cases who will have likely been infected 5 days before that. So the average incubation of the virus is about 5 days. So really what we're looking at is the impacts of the reduction in social mixing that's happened over 2 weeks ago. That means that we'll not begin to see the impact of the relaxation of those restrictions for another 2 weeks. And so it's really important that we don't rest on our laurels seeing this reduction in cases and think, oh, we're all fine to go out and mix and not stick to those social distancing, hand washing and face covering measures. I also wanted to point out with this sort of turning the curve, this is absolutely not reflective of case rates of COVID in hospitals. So we know that usually people, if they are hospitalised with the virus, it takes about a week or 2 weeks for people to get that severely ill. So we can see that case rates still haven't decreased in hospitals yet. And that is really important as well as we approach winter. And I'm sure Dr. Watt and others will touch on this as well. There are huge pressures on our acute services. And it's absolutely vital, again, that all of our community just does as much as they can to prevent transmission and to keep those case rates low, because case rates do translate to, unfortunately, hospitalised cases and even more unfortunately deaths. And so I just wanted to raise that note of caution. It does look like a positive slide, but we really do need to be cautious. And next slide, please. I won't touch too much upon this because in the next slide we see these trends in graph form, so I think that's a bit easier to follow. Just to I guess show for the district and boroughs that trend that we've seen in the county is also mirrored across all of our district and boroughs, which is positive. The one thing I would like to note that if we see the case rates in England, which is the dotted line, are decreasing much faster than the case rates in the county, which is a dashed line. So you can see that the dashed line and the dotted line are coming closer together because the England rates are falling a lot faster. Again, something that we need to be really careful of. And if we move to the next slide, please, which shows age profile of our cases in recent weeks. And again, although this shows that the bulk of cases are in the under 60s, so that's where the big bulge is from ages 10 to 19 upwards to 60, it's really important to note that if we looked at a sort of a series of these graphs over time, the cases in the over 60s and particularly the over 80s are much higher than they were 3-4 weeks ago. And so it looks as though then they're not a big proportion of the total cases, but they are increasing. And as I said, that's a concern. If we focus on those over 60s cases, in the next slide, we can see trends in rates of cases in the over 60s and see a spike in Corby as well as South Northants. So we have done some analysis with our colleagues in Public Health England of these higher rates and believe that the majority of that increase in cases in those two boroughs were related to care home outbreaks, quite significant care home outbreaks, which explains that trend, but again, it's not, doesn't say that's not something to be concerned about. I think we're always concerned about cases in care homes, given the risk of infection in those populations. And if we move on further, and again, we've seen the cases by district and borough. So if we skip again to the education slide, to show that there has been some sort of stabilisation in cases and clusters or outbreaks in the schools. So when we look at the proportion of schools open and proportion of children attending, there hasn't been the sort of continued drop that we were hoping to avoid. So things seem to be plateauing there. In terms of the university, so we've seen 10 new cases in the last week being identified at the University of Northampton, and hopefully by next week we should have some figures on the asymptomatic testing that's been going on at the university. Finally, if we move on to a more granular picture of the county and case by community, I'd like to skip on to the next slide because that's total numbers and doesn't give a very good indication of rates per population. So this slide shows the areas with the highest rates of cases in the last 28 days. There are some areas that have been up there in terms of case rates for quite a while. I'm thinking of Middleton Cheney, Little Billing, that have appeared a few times. So I don't think we're seeing any huge changes in these, and we are working with district and borough colleagues to look at the individual case data in those areas to see if we can sort of be more targeted in our approach and identify any particular situations that might be increasing transmission in those areas. And then finally, I think the next slide shows change in cases. So that's just to show those areas that are increasing, rather not just have high rates, but are increasing. And again, if it's useful to look at these and compare them with the total case rates, because there will be some areas that are increasing, but still at fairly low rates. And then moving on to the outbreak slide. So in terms of total outbreaks, exposures, clusters, there has been a slight increase from the position last week, but not compared to the previous week. So we are hovering around 100 situations, so either clusters or outbreaks or exposures that are active in the month period. If we just look specifically at outbreaks, we've got 64 that are currently active, so have had cases in the last 28 days. Care homes make up 21 of those 64. We have seen this figure be around the mid-teens for the majority well, certainly since the summer. And so 21 is a little higher, but not significantly higher than we've seen in recent weeks, and not of particular concern. We've seen a reduction in the number of outbreaks at workplaces and education settings, but an increase in the number of outbreaks at hospital settings or hospices. Again, I think it's reasonable that if we've seen high rates in the community, that's going to be really challenging to prevent outbreaks from happening in healthcare settings. Finally, if we just move on to the last few slides that just remind people about those, apologies, an important slide on winter flu. Some good news in terms of flu vaccination coverage in the over 65s. So this is data up to the end of week 47. So the 22nd of November. I've seen more recent figures that show an even better picture than this for the over 65s. So we've far exceeded our target of 75%. We're now on 78% uptake in the over 65. So we still want to, get as close to 100% as possible, but I think that's really positive. Where we still need to reach more people, significantly more people, is in the under 65s in at-risk groups. So under 65s that have underlying health conditions, pregnant women, and children as well. Then apologies, finally moving on to the public health measures, just to remind everyone of those measures that we're still undertaking, working a lot with partners to try and control the spread of the virus in the county. And I think I hope I've kept to time. That's all that I was going to share on those slides, but happy to take questions later on. Thanks very much.
Very much, Rosin, for that very good summary of where we're at. It does seem that there is some good news in the figures, but we can't be complacent, especially with a vaccine potentially around the corner. We've got to try and adhere to the tier 2 rules and make sure that we're driving this virus down. And obviously we want to try and end up in tier 1 at some point, should the tier system remain in place. So thank you for that, Rosin. Can I bring in Joe Watt, the GP chair for the Northamptonshire CCG, and really appreciate you being here, Joe, because I'm sure you're insanely busy, just like our other hospital colleagues. Joe.
Thank you, Councillor Morris. I think it's fair to say that the whole health system is incredibly busy. That's general practice, that's the community teams, and that's the hospital as well. And I think it's really important to emphasise that we are all working really hard together to keep patients where they need to be, to avoid admitting anybody to hospital that doesn't absolutely need to be there, appreciating that there are still some accidents and some emergencies. But what I would urge people to do is just to think about where your care can best be provided. If you're not sure, call 111. They will be able to guide you to the best place for care. Pharmacists are able to offer lots of care as well, and it's not always about going to A&E. Over the weekend, the out-of-hours doctors, out-of-hours GPs are available, so it's not just A&E that's open through the weekend, and they can be contacted via the 111 service, and there's also called the Urgent Care Centre as well. So there are lots of options. It can be really confusing. We know how confusing it is. So if you're not sure, 111 will help you to get the care that you need. I wanted just to say a little bit about the flu figures that Roisin has referred to, and really just thank all of our colleagues across primary care, not only general practice but pharmacy as well, for such a fantastic uptake. This is actually a really good opportunity that if you've been putting off having your flu jab, this is a good time to get it done. And that's partly because of the COVID vaccination coming along, because we do know that there will need to be a gap between having your flu jab and your COVID vaccination. So if you've been putting it off, get your flu jab now so that you don't delay your COVID vaccination when you're called for it. And that will really help the flow of matters across the system. As Roisin mentioned, the over 50s, so the 50 to 64-year-olds are now eligible for flu jab. And they're not a group that we've previously invited, but this year and this winter is unusual. And you can book that via your GP surgery. Some of the vaccine supplies are still coming in, so please be patient. But if you are between 50 and 64 and don't normally go for a flu jab, or you're in an at-risk group and you have just been putting it off, you can contact your GP surgery and they will book you in for a flu jab. Some pharmacies still have supplies as well. What I would say to people is, if you are thinking about the COVID vaccination, and obviously we're all really excited about a way to get out of the situation that we're in at the moment, please do not contact your GP surgery. You will be called. You will have a personal invitation according to either your risk group or your age group, and you will be called in order. Nagging your GP, going on a waiting list, all of those things. At the moment, there is no point in doing that, and you risk blocking the phone lines for the poorly people who are trying to call in. So if you're interested in the COVID vaccination, my advice to you is wait. You will be called. You will have a personal invite, and we'll make sure that everybody is offered that vaccination when their time is coming. Thank you.
Thank you very much, Joe. Yes, I think we're all very keen to see this vaccine, but as you say, we must be patient and not get too overexcited just yet. So thank you, Joe. I'm going to come to the questions now from the press, if I may. Tom Hitchener from Northants Live. I'm going to bring you in, Tom. A number of your questions were for Simon, who obviously isn't here. Because obviously they're extremely busy, Tom. So you may want to ask some different questions. Anything you ask, obviously, of Simon will be directed to him for them to answer outside of this meeting. So you don't need to worry about that. And Joe may make comment on very generally on some of the questions if you want to ask about vaccination. Tom, are you there?
Yes, I'm here. Thank you for that.
No worries.
Shall I just list through all three of my questions, or do you want them individually?
Are they the ones to Simon?
Yes, we would. Even a general response would be great.
Okay, well, fine. If you fire away, if you ask the questions, and then we'll come to someone on those. Thank you.
Brilliant. I suppose first off, we just wondered, would the army be involved in the vaccine rollout, and if so, what would their role be? The second point we wanted to ask was, at the moment, how many people will need vaccinations in Northants as a whole? And finally, what special measures are currently being taken at Northants hospitals to prepare for this vaccination rollout? Those are the three main points we wanted to ask. Thank you.
Thank you very much, Tom. And we will make sure that Simon gets those questions and that he answers them. But I will just come to Jo Watt to give she's already mentioned vaccination very generally, and I don't think she can go into the specifics so much, but she can probably give you some answers to a bit of those questions. Thank you, Jo.
So I think it's fair to say that we have a large number of people across the whole health and care system and wider public sector as well, working on the vaccination, making sure that this works for our population. And it is going to involve all sorts of people. It's going to involve doctors, nurses, pharmacists, care coordinators, voluntary sector, security, all sorts of different people to make sure that this is a real success for the population of Northamptonshire. So I think it's fair to say that we have got a really, really broad range of people. We are coordinating the workforce that we need to deliver this, but it's going to involve lots and lots of people, not least the general public. I'm really grateful for the media for supporting this as well, to make sure that we get this right. So it is everybody together coordinating it. As long as people are registered with a Northamptonshire GP, then those are the lists that we will use to call people in. So you know, that's all that you need to do. You will be called in the right age groups, and that will be coordinated as we go through and as the vaccine becomes available.
Thank you very much, Jo. And thank you for the questions, Tom. As I say, we'll make sure that Simon gets those questions and that you have answers to those, or maybe you might want to ask them again next week if he's on the call, although they are extremely busy, which we appreciate. So I'm going to come now to Alistair from the Chronicle and Echo. And again, Alistair, hi, good afternoon. You've got a couple of questions to Simon Wellington. I don't know whether you want to ask a slightly different question. We will make sure that gets to Simon to answer, but you did have a couple of other questions as well. Hi, Alistair.
Yeah, thank you. Mine were more pivoted around Northampton General Hospital, if anyone's able to help me with that one. I suppose I should, would it be Jo, or is anyone else able to help me with the General Hospital situation?
Simon is the chief executive of that hospital, so we will leave that and come back to him with the answer. We'll get an answer for you, let's put it that way. But you had a couple of other questions. Thank you, Alistair.
Okay. If Simon's not available, do you mind if you come back to me? I might go and have another look at my questions in that case. I think I need to do a rethink. Hope that's not too candid. Do you mind if we come back to me in a bit, if that's all right?
No, not Alistair. Sorry. I mean, we're happy to move with the situation, so don't worry. I'll come back to you. So I'm going to come to Jack Duggan. Hi, Jack.
Hiya.
Hi. Similar to you, though, I know you've got a question for Simon, and I think Jo sort of already really covered a lot of that as much as she can, but we'll make sure Simon is asked the question and answers it. And you also had a question for Becky, which we'll also make sure is answered for you. So sorry about this, but they are both extremely busy, as you can imagine at the moment. If you wanted to You had one other question, and of course you can ask anyone on the panel a question, or in fact anyone who's on the meeting. So over to you, Jack.
Yeah, no worries. I guess maybe for Jonathan Nunn or anyone else, politician, I guess just about the lockdown ending this week, with pubs and non-essential shops being allowed to reopen, as well as many others. Just wondering what you make of that. Are you pleased, or do you think it should be going on for longer? Obviously, with Northampton now in Tier 2, do you think that's the right thing
Thank
for
you.
where we are at the minute?
Thank you, Jack. I'm going to come to Councillor Tom Beattie, who's the leader of Corby Borough Council, and then maybe Jonathan Nunn after that. So, Tom, hi.
Yeah, thank you, Ian. And yeah, thanks for that question. Clearly, getting the balance right between keeping ourselves safe and the public safe, and ensuring that our local economies don't grind to a complete halt is a difficult one. I mean, I'm pleased. If you're asking me, am I pleased that pubs and non-essential shops are open? I would have to say, on balance, yes, because it introduces some sort of normality back into life for people. We can manage that situation if people, adhere to the regulations, the guidance that has been provided, if proper rules are followed in hospitality establishments such as bars, restaurants, or indeed in those non-essential shops, then that can be managed. And I would, so in that respect, I would welcome that slight easing. I mean, it doesn't mean that that we're back to any sort of actual normality. There are still things that need to be done to ensure that sort of activity doesn't put either the individuals concerned at risk or others. But it's not an easy thing, and I know that people have struggled through lockdown. They continue to struggle. I think both myself and Jonathan and others, week after week, we make this point about the way this has impacted on people's normal daily lives, the pressures that has put on people, their desire to see family, to mix with family, to visit friends, to socialize, all the things that we would take for granted normally, we've had to forego. So anything which restores a semblance of normality, I think, is welcome. But to just reiterate the message that we've continued to give, that even with a vaccination on the horizon and beginning to roll out, within days it would look like, we're not out of this yet, and it's still very, very important that we take care, that we do the things that we've been asking people to do for the last months in terms of hand washing, social distancing, mask wearing, all of the things which protect us. I think we need to continue to do. And if that happens and the vaccine is rolled out, then normality will return at some point. But at the moment, it's still important to be ultra cautious about how we behave, both ourselves and how we interact with others.
Thank you very much, Tom. Couldn't agree with you more. It really is vital that we all adhere to the Tier 2 restrictions for as long as we can. I'm going to come to Jonathan now, who always has some very good messages for us all. Jonathan.
It's kind, Ian. Thank you. Afternoon, everybody. And really, it's full agreement with what Tom says. It can only be an on-balance type positivity, really, because there's such a contradiction here, isn't it? The blunt facts are the more we mix, the more people catch the virus and suffer as a result. But actually, the longer we keep our businesses shut, the fewer we're going to see reopen again. And some are really feeling a strong pain on that. The only thing I would say is that they are open and that we hope we minimise the infections. We are continuing as councils alongside the police to both guide businesses and enforce where they are not meeting these standards. And it's an assurance to the public and to those who are visiting pubs and other venues. We'll continue to do everything we can. And we're not being soft on that at all. We have now the power to get businesses to make instant changes to the standard of their precautions. Similarly, if we don't think they can do it and remain open, we can shut them down for a period of time while they make those, and we're not shying away from that. Our absolute assurance to everybody is that you will be safe if you come into a venue, or those precautions will be in place to make you as safe as you possibly can, and we'll continue to do that in actually a pretty tough way. Thank you, Ian.
Thank you very much, Jonathan, as always, and thank you for your question, Jack. I mean, the worst scenario would be to end up in tier 3 at any point as well. So we must adhere to tier 2 rules and try, if we can, if the tier system is still in place after Christmas, to make sure we're in tier 1, which will help protect our businesses and everything else. So it's still vital that we follow those rules. Thank you, Jack, for your question as always. I'm going to come on to Kevin Nichols. Kevin, hi, sir.
Hi, Ian. Good afternoon. Can you hear me okay?
You did have a question for Simon again there, but you may want to...
I did, yes. And since you kindly put out the surveillance reports in advance of today's press conference, I had another one about schools, but I'm not sure that's going to be answered either, is it? I don't see anybody here from the education today.
They don't seem, I don't think they are today, no. But if you, I mean, feel free to ask the question and we can make sure you get an answer.
Yeah, it was simply about the stats on the 100% of schools being open. We know of at least 4 where there are entire year groups off for periods of a week or more. I just wondered how it can be justified to say that 100% of schools are open.
Thank you.
I do also have a follow-up for Rosine about the care homes, if that's okay, if I could, please.
Yes, of course.
Thank you. Yeah, Rosine, you mentioned a big increase in care home cases in care homes, which was down, you think, to significant outbreaks in a couple of areas. I did notice there was also a big increase in care home deaths last week. I just wondered if that's related to the same situation. And also, some of the rules on care home visiting has been relaxed this week. I just wonder if that's a concern to you at all.
Thank you. Very good questions, Kevin. I'm going to come to Rossin then on. She can probably answer some of the schools. Obviously, Paul will be joining us from the school cell, but I'm sure Rossin can give some answers to that bit, and certainly
thank you.
Care home stuff. Thank you, Kevin. Rossin.
Yeah, starting with the schools question. So the schools open is just a record of or a measure of schools that are in any way open, whether it's only half the year groups or everyone in this. So if there's an entire year group or 2 year groups that have been sent home, that will still classify that as an open school. But I'll take that question back to the education cell, whether we can break that down in terms of fully open and then maybe with some year groups that are at home. But that is the measure. It's schools that are to some degree open, if that answers hopefully that question.
Thank you, it does, yes, brilliant.
Yeah, in terms of the counts, I should have said rather than the spike in cases was a spike in cases in the over 60s. So I wouldn't like to say we've had a significant increase in care home outbreaks, because we have seen around the 20 mark of active outbreaks at any one time in care homes at other points during the pandemic. But we have had a couple of outbreaks recently that were larger in care homes. We've seen the trend from the summer of rather small outbreaks, so 1 or 2 cases, and then no further. And there have been outbreaks that are a bit larger than that in recent weeks. There's no indication that I know of, I haven't been involved in all of those outbreaks, that there's any indication that's related to visiting in any way. And I'm sure they'll have various factors that are influencing them. In terms of the visiting policy and supporting care homes to allow visiting more safely, I think first of all that we know that overall for health and well-being of people, visiting is really important. The fact that many people will have not been able to see their relatives for several months, if not a year at this point, will be detrimental to the health and well-being of those individuals. And again, it comes back to the point of balance, to what degree we want to minimize the risk of transmission as far as possible, but also minimize the adverse impact on people's health and well-being that a lack of visitors will have. So the lateral flow testing, I think, is going to be really helpful. So that's the rapid testing available to care homes, that will be made available to care homes to test their visitors, will be helpful. I want to really emphasize that the rapid testing, because it's not 100% sensitive, so it won't pick up 100% of positive cases, is purely to reduce the risk of exposure to potentially infectious people, and not to eliminate the risk. And so all precautions, all infection control measures, wearing all the protective PPE, maintaining distance, and being as careful as possible in those visits is still absolutely vital. So I wouldn't want anyone to get the message that the rapid lateral flow testing is going to allow people to just abandon all infection control measures, because it absolutely isn't. It's just an additional safeguard on top of all of the measures that people should be taking already, to try and reduce that risk further. I hope that's answered those questions.
Thank you, Rosin.
No, it has. Thank you very much indeed.
Thank you, Kevin, as always. And the rapid flow testing, as Rosin rightly indicates, is going to be something really important to help with the visiting rights that in adults, older adults and things like that. So we definitely welcome that, and look forward to some positive news on how that might help with visiting and the general regimes around care homes, etc. Martin Griffiths, you've got your hand up, sir. I can see you've got a hand up there. Can I show you next, sir?
Yes, thank you, Ian. And I'd just like to pick up on the schools and the importance that we keep as many children at school and in school as possible, but also say what a tremendous job the schools have done in safeguarding staff and, of course, pupils. All the advice is that children's learning is absolutely vital, especially at this moment in time, and indeed their general well-being is better served by them being at school. Thank you.
Thank you very much, Martin. I think we all agree with that, and it has been remarkable how well the school department has worked, as you say, to keep 100% of schools open, albeit with various classes closed within that. So, and also the university, of course, always don't need any praise, because they've been working extremely hard to keep the numbers of infections down there, and are working extremely hard to get all their students home for Christmas. And the students in Northamptonshire have behaved impeccably and deserve a lot of credit for following the rules as well. So thank you, Martin, for that. I'm going to come to Laura Coffey now, and then back to you, Alistair. So Laura, you did have a question for Becky, but I'll come to you now, Laura. Good afternoon.
Oh, good afternoon. So I did have a question for Becky. Obviously, she's not on the call. So an additional couple of questions that I had. One of them was that the BBC Data Unit has done a bit of analysis on that over 60s case rates. And so this is for Rosin Harris. It found that they're looking at the data up to the week of the 28th of November, and it found that East Northants infection rate amongst the over 60s was 101 more than the rate in the under 60s. So that difference between the cases, why is that basically? Could that be, I know, Rosin, you mentioned about Corby and South Northants having those care home outbreaks. Could that be a reason between those differences, or what is the difference? And Corby also was listed in that data analysis as well. And then my second question to Councillor Beattie, Councillor Morris, Councillor Nunn and Councillor Griffiths. Since we've been allowed, have any of you been out for a substantial meal and a drink? And if you have, what have you had?
Thank you for those questions, Laura. I'll come with, and thank you for that, as always. I'm going to come to Rosin first on the first part, and then I will answer your second bit along with Jonathan and Tom, and no doubt Martin will have something to say on that as well. Rosin.
Thanks, Laura. And actually, I'd like to go back to that, the analysis I mentioned that PHE had helped us with to see how much of the case in over 60s could be explained by care home outbreaks, to just check the East Northants. I don't believe that in East Northants it was felt that the majority of those cases could be explained by association with care home outbreaks, that it was South Northants and Corby specifically where the vast majority of that increase in over 60s cases were linked to care homes. But can I go back and double check that analysis, because just to make sure that I'm giving you the right answer about East Northants.
Thank you. Yes, we'll come back to you, Laura. Quick answer to your question. No, I haven't been out for a substantial meal yet, but I'm looking for somewhere that does a large Scotch egg, probably this weekend, in order to perhaps enjoy a drink with my Scotch egg. But I don't know yet. I haven't been anywhere since the rules were changed. So I'm going to come to Martin Griffiths and then Jonathan and then Tom very quickly, since you asked for all of us. Martin.
Thank you, Ian. And I can't stand Scotch eggs, but we eat in. Tea's on tonight. One thing I am looking forward to is a Christmas dinner with all the trimmings later on this month. And I just hope that we're in a far better and stronger position at that time. I pray that is the case. Thank you.
Thank you, Martin. Jonathan.
No. As it happens, I haven't, like you, either been out. I was thinking about it for this weekend. I'm sport for choice in Northampton. There's lots of great local places where I could. But actually, more seriously, I'm being particularly cautious. I continue to take shopping to my elderly mother each week. And as a consequence of which, my policy is not just to stick to the guidelines, but to go beyond them, really. And that's partly why perhaps I've been slightly reluctant at this point too. But I am inclined to want to support local restaurants of some sort this weekend. So I think there's a very good chance. Like you, I'll be out looking for something, Ian. Thank you.
Thank you very much, Jonathan. Tom.
What a boring bunch we all are. No, I haven't been out either. The last time I left the house was the day before the rules changed, and I went for a walk in the woods. But I am. I mean, I take Jonathan's point about supporting local business. I mean, yeah. I mean, I'd like to think that I might be able to get out at some point and have a substantial meal and a drink, but I haven't as of this week yet.
No, thank you, Tom. I mean, I've got a very good farm shop quite near me, so I might just go and get a takeaway from there just to help support the local economy as well, rather than dip my toe into going to anything any more expansive than that at the moment. But thank you all for that. And thank you, Laura. I'm coming back now to Alistair, because you said you wanted to come back in. Alistair Ork. Hi, Alistair.
Thank you, and yeah, sorry about that. I sort of had to read my questions to realise I wasn't sure how to get the answer from this week. I guess on top of the discussion earlier about how we're going to roll out the vaccine, how people will get invites as well, could someone talk to me more about how it's going to be rolled out, hopefully, to care homes and NHS staff, basically? Because it's good for members of the public, of course, that will get invited to say, will there be programmes at care homes? Will they be invited? How will it be rolled out to NHS staff? Have we had any steering on that so far?
Thank you, Alistair. I think that's all still probably being worked out, but I will come to Rosin and Joe for a very, very sort of very brief line on it, because I don't think anyone really knows the absolute plan as yet. I'll come to Rosin first, then Joe, if I may.
I'm afraid Joe might have more detail on this than me. I would, and might be close to planning. I would assume for those groups that it's easier to reach in the setting rather than at their GP practice, for example, healthcare workers and in care homes, that the approach will be much like the flu vaccine, and people will be offered vaccination at that setting, so either at work or in the care home. But I don't have the detail on the planning for the COVID vaccine, I'm afraid.
No, and it's one of those things. It's still being drawn up, I suspect. Joe, did you want to make a very general comment? I know you've already spoken about vaccines.
Yeah, so I think we're very mindful that care homes and those people who are housebound absolutely need to get it, and as soon as the vaccine arrangements allow us to do that, they are very much one of our groups that we are keen to make sure that they get offered the vaccination, as well as the over 80s and the health and care staff. And we're really just working through the details to make sure that those people get the vaccines that they need. But it is important that we do make sure that they're vaccinated, and we will do that as soon as is practically possible.
Thank you very much, and thank you, Alistair. I'm going to come now to Stuart Ratcliffe. Hi, Stuart. How are you?
Hi, I'm fine. Thanks for letting me in. Just a quick question, maybe to Racine or Jonathan Nunn. Just looking at the details for all the district and boroughs around the county, I just wondered how concerned or disappointed they were that Northampton and East Northamptonshire are still above the English national average in terms of cases per 100,000.
Thank you, Stuart. I think I'll come to Jonathan first on that, and then Rossin may want to make a comment, but I'll go to Jonathan first. Jonathan.
Yeah, thank you, Ian, and thanks for the question, Stuart. And the answer has to be, yeah, naturally extremely disappointed. I mean, we've worked so hard. We've seen ourselves go above the national average, and people have responded, and we've come back down below. We went reasonable distance above, and now we're continuing to follow the trend, but still being above is incredibly frustrating, because when you go around Northampton, as I did the other day for a little walk around, you'll see that people are coming out after the lockdown, but they are all being pretty careful, is my observation. And I know that so many people are putting so much effort in, but sadly the reality of it is we continue to be above that figure. There was a question, I'm not sure if we actually covered it because of the, I think it might be one of Alistair's, you know, is tier 3 a real possibility? I think the answer to that has to be yes, it is, particularly with Northampton as we are. We are that larger part of the population of the county, of course, and our rates are high. So at this point in time, in terms of restaurants being open and all the other restrictions that we don't have as a result of being in tier 2, we are knocking on the door of tier 3. And one of the symptoms, one of the aspects that illustrates that is those increased infection rates. So that's of enormous frustration to me, because I do know going up to tier 3, I think we'd put further restrictions on people that I think we'd all find really, really hard to cope with, extremely hard to cope with, as I see how much people are enjoying and benefiting in their own state of mind from the greater freedom we've had in the last few days. To think about going into tier 3 would be absolutely rotten. So it's tremendously disappointing to me, and it's our chance again, perhaps. Your question gives us the opportunity to say to people, please, please, please act as carefully as you can. Be really, really careful. Let's keep out of tier 3, and let's get our rates in Northampton back below the national average.
Thank you, Jonathan. Rossin, did you want to comment? Or I think Jonathan probably covered that extremely ably, but you may wish to comment.
I think he has, yeah. No, I don't think there's anything else I could add to that. Thank you.
Thank you, appreciate that. Thank you.
Thank you, Stuart. Thank you very much for your question, as always. I think, unless I'm mistaken, that brings us to the end of the questions, unless anyone has any that they wish to ask. I'm just looking around the room. No, in which case, thank you very much, everyone, for attending today. Just as a personal reflection, this second lockdown has been very tough, I think, on lots of people. I found this particularly onerous, this second lockdown, but we have to do it. We have to do it for the people of Northamptonshire, and we have to keep this virus at bay until such time as this vaccination can be rolled out across the county, which unfortunately will take some time. So on that note, I wish you well. I hope you all have a very good weekend. And stay safe and well, and follow those rules. I'll see you again next week. Thank you very much. Goodbye.
Thanks, Ian. Thank you.